of 3 Veterans Village outreach efforts during the month of May. And joining me once again are outreach coordinators Tony Nagata and Carmelita Calvo. Thank you so much for being with us again today. Let's go ahead and get right into it. You have a series of events, as I said, and you also want to encourage the families for servicemen and women who may be deployed right now to show up and represent them. Tell me about that.
Definitely. I invite all the family members of our soldiers that are currently deployed to Afghanistan, as well as those that are deployed from other armed forces to other areas of the theater, to come out and listen to these veteran service providers so that you can obtain ahead of time so you can be knowledgeable, or empowered with the knowledge of what benefits are available when your spouse or your loved one returns.
And what kind of benefits are those? Like in addition to counseling and just being able to network with other people's, maybe their spouse or maybe their father or their mother or their son or daughter may be deployed over. What can they avail of?
Jason, what Tony and I do is we go out and we get service members, veterans, and their families that are interested for services. We link them up to those services with perhaps the CBOC, like I said, the community-based outpatient clinic, the VBA, the Veterans Benefit Administration, or the governor of the Guam Veterans Affairs Office. But our main push here is for the Vet Center we invite these veterans and their families to seek counseling services from the Vet Center, so that they can readjustment counseling, marital counseling. All these services are available for them.
And there are a ton of services that people can use. So basically, you're just trying to say, hey, if you didn't know, there are a lot of things that you can take.
And our job is to link them to those services. We do not submit or approve applications or whatnot. We just connect them to those
point them in the right direction.
Services.
We try to break down barriers. Whatever it is that possibly could be an obstacle or anything that would hinder how and why a veteran would access services. We try and eliminate that or break
such
it
as
down.
give me a couple of examples if you would.
I'm going to use myself as an example.
Okay.
My last deployment was I came back from deployment in November 2010. I'm eligible, I am eligible for 5 years of free VA health care. I was aware of it. But what took me so long to finally get my paperwork in? 2 years that expired. And now I'm only eligible probably for maybe 2.5, 3 years. So it's like we probably want to be the ones who are going to help to motivate people to, escort them if necessary to the necessary, or maybe because let's face it, we have earned them, these benefits and services. We are entitled to them, and especially when you're dealing with the federal government, it's numbers that drive things, whether it be funding, legislation, and all that. It's all about numbers. So we want to stand up and be counted. If a clinic is existing, or it's in existence there and nobody's using it, or taking advantage of the services, especially if you've earned them, then things are waste. It's a waste.
And again, if you've served time in the military, you know that the military provides for so much of your well-being, and then when you transition again out into civilian life, a lot of times it's you get what you pay for, and if you want a certain service, then it costs money. But as you said, these servicemen have earned the right to avail of these services, and you're just making them aware of it, whether they use it immediately or not. At least you know.
Right.
Okay. So I'd like to hear from both of you. What does doing this job and what does this work mean to the both of you as people who have been deployed yourselves? How does it feel to help somebody else in that situation?
Well, Jason, I just recently retired after serving 29 years of active service with the United States Army, as well as with the Guam Army National Guard. And I'm proud to be an American, and I'm proud to have served our country and our people, our island of Guam. And I was fortunate and honored to have served with the Alpha Company, 1st to 94th Infantry in Afghanistan in 2007 and 2008.
Can I get you to say hoorah for the infantry?
Hoorah! Yes, and as you are well aware, we lost 2 of our soldiers there. And that is very touchy, and to this date I still get sentimental about it, you know, and I still remember them. And I remember the time when we were there, and although I may not have physically killed anybody or shot anybody, you know, we have to form up a cordon called, and every time a person dies, they come and we render a solemn salute. That is so very touchy, you know, and it impacts us. To this date, I'm still affected by that. To this date, I have not returned fully to the person that I was when I left the island. And a lot of circumstances are taken into consideration, and I guess, you know, part of my job is to seek people such as myself that are either in denial or have that stigma of saying, you know, I don't want to be labeled as crazy or not in touch with life or whatnot. And some of us need a little bit pushing, you know, to go and apply for those benefits.
Real quick, I'm sorry, unfortunately we have to cut you off, but is there a phone number where people can call? We got to go to commercial, but where can people call for more information? This is wonderful.
They can call me at 488-9003, or they can call our office at 472-0218.
Okay, Carmelita and Tony, thank you so much for what you do.
Thank you.
All right, and stay tuned because we will be right back after this.